Hello, everyone. My name is Steve Allen. I am with Emory Communications, and I'm joined by Dr. Denise Jamieson, the James Robert McCord Professor and Chair in the Department of Gynecology and Obstetrics at the Emory University School of Medicine. Dr. Jamieson, thank you so much for being here with us today.
Happy to be here.
We have gathered many of the common questions we've heard from pregnant healthcare providers in order to ask them here. We'll start with the first question. Is it safe to care for COVID-19 suspected or positive patients if you are pregnant?
There's limited evidence about the severity of COVID among pregnant women, but so far, from what we know, there's no evidence that pregnant women are more severely affected by COVID. Therefore, pregnant women can continue to work even in this time of COVID. It makes sense, if possible, to limit exposure of pregnant women to patients with COVID, particularly aerosolizing procedures such as intubation, extubation, bronchoscopy. If feasible, it may make sense to reassign pregnant healthcare workers to avoid those types of procedures when possible.
I'm pregnant but don't work in direct patient care. Is it safe for me to work in the hospital?
So for pregnant women who work in a hospital setting but aren't directly interacting with patients, they should continue to do the same things we're recommending for everybody. Things like wash your hands frequently and avoid touching your face.
Are there additional specific PPE guidelines for pregnant staff?
So pregnant staff should be observing the same PPE principles that we are recommending for all of our staff.
What studies have been conducted on this issue, COVID-19 and pregnancy?
So we have limited information in terms of COVID in pregnancy. We have some small case series coming from China that don't show any increased risk of severe disease in pregnancy. We're just starting to get the first reports of pregnant women in the United States, and we'll need to see how pregnant women in the United States are doing compared to the experience in China. So I think in the next few weeks, it'll be really important to start to find out more about COVID in pregnancy so that we can better counsel and manage our pregnant patients.
What are the factors that would change the CDC guidelines on pregnancy and caring/interacting with COVID-19 patients?
CDC's guidelines are evidence-based, so they're continuously reviewing the literature and what's known about COVID to try and make the best national guidance that they can based on rapidly emerging information. And we use CDC guidance in order to be able to make evidence-based recommendations for our patients here at Emory.
Are there any additional precautions I should take as a healthcare provider?
As a pregnant healthcare provider, you should take the same precautions that we're recommending for any healthcare provider. Proper, consistent, and correct use of personal protective equipment, avoiding touching your face, washing your hands and using hand sanitizer frequently. So it's really important, pregnant or not pregnant, that as healthcare workers, we ensure that we are not getting infected with COVID and we're not infecting our patients with COVID.
Dr. Jamieson, this has been very informational. I really appreciate you taking the time today.
Thanks very much for your interest in COVID and pregnancy.